So let's talk about this idea of not having time in order to be able to eat healthy, move, things like that, that barrier of time. So let's think about the concept. So those who don't have time to eat healthy and move, you're going to have to eventually find the time for illness. And that's what happens is when we kind of put things off and put things off and put things off, the body starts to not function like it can function or how it should function because it's not in true homeostasis. And so you're way more likely to have things come up that don't go well. And then what that means, it's cost, it's time, it's energy, all sorts of different things that could be preventable. And so the idea of prevention is not always the most fun, and it's not ever guaranteed. So you're putting your eggs into this prevention basket of, I'm going to spend energy and time, cost, things like that in order to get ahead of something. And it's without 100% guarantee. And so sometimes that feels like it could be a waste of that time, energy, money, whatever might be going on. However, I always try and say like, well, what's the alternative? So if you don't do this, and if we don't kind of try and eat that balanced diet, eat the rainbow, meaning eat all the different colors of food every day so that we're getting that balanced amount of nutrients that our body needs to function, stay hydrated, sleep well, move your body, keep your stress level in check, have positive interaction with those around you, interpersonal relationships, those kinds of things. I mean, they're kind of more or less kind of not really complex concepts. Let's say like that it's just, not going to happen. The alternative really could be it could be pretty big. So you really could come up with some things that aren't so fun, and they cost money and can be intrusive and really painful and not fun. So I'm always like, well, what if we just don't react to what happens and we prevent it? You never really know what you're preventing. That's the problem, is like you don't know that you just prevented a major surgery or cancer or some sort of chronic incurable illness, diabetes, for example. You don't really realize that until you see somebody else go through it, or maybe then you go through it. So let's bring it back to how can we think more about prevention, even though it isn't 100% guaranteed. I kind of try and, for me at least, frame it in a way of it's okay that it's not 100% guaranteed, because there's enough data, there's enough science, there's enough information out there that shows that this information is valuable, it's reliable, it's reproducible. And so that for me is enough to say, okay, it makes sense that I do put some time into meal preparation to make it achievable for me to eat the rainbow, and my family to eat the rainbow every day. The science is there to back that and say, yes, like the odds are in my favor that this decision is going to put us in the right direction. The same thing with movement, right? We know that movement improves every system of your body. And systems mean the nervous system, brain and spinal cord. Another system is your cardiovascular system that improves with exercise. We've got, the system of how your hormones all get released, which improves like stress levels, mood, things like that. That improves with exercise. Your musculoskeletal system, so muscles and bones, all improve with exercise. So, and stay healthy and operate at a higher level when we exercise. So the data is there. Let's put our eggs into that basket and try and stay proactive. Same thing with sleep. Sleep is known to be very helpful for how our body resets for the next day. So it is super important to get quality and sustained sleep so that you get that restorative phase. And so that is also like well documented, how it helps with, overall nervous system, mood, the immune system, just overall healing and reset for the next day. You'll feel better. So there's a lot of reasons for why it does make sense to try and be proactive and preventative with your decision making for how you prep for your day, prep for your week, and just overall put things so that you're moving in the forward direction rather than constantly waiting to react. And that's something that oftentimes the way our medical system is set up is that we wait until there's a problem and then we go and seek help. And so having a good GP that you work with, a general practitioner, and seeing them yearly is a great way to be able to say, okay, like I would like to work with you to make sure that I'm doing my blood work, I'm monitoring blood pressure, I'm just monitoring all of these systems of the body, and that way that you can catch things early. Working with a physical therapist to say, hey, like I want to make sure that I keep, whatever it is, my balance in check, that I keep overall that joint that doesn't like to move well, that I keep it moving, things like that. Don't wait until it stops you completely. If it's even starting to go in the wrong direction, like intervene there, and then it's so much easier to get right back on track than once you've really, really, really gone downhill. And so just kind of getting into like a little bit of a faster mode of intervening is key. So my rule of thumb is always, if you're putting your eggs into the prevention basket and it's going well, great, you're doing it. Like you're doing it right. That's awesome. Stay supported, interpersonal relationships, accountability partners, all that kind of stuff, all sorts of stuff online, good recipes, workout ideas, things like that. Perfect. If something has derailed you and you're off just a little bit and you're having a hard time getting back on track, and it's been more than a couple of weeks and you're honestly, like more than 2 weeks, and you're honestly really having a very hard time getting back on track, it could be pain, it could be something else, who knows? That's when it's time to ask for help. Don't wait until it's been 3 months. So if it's really that hard to get back on track, because when one thing starts to get derailed, a lot of other things start to get impacted. And so an easy example is, I hurt my knee and now I start to limp. And I was, let's say, running 3 days a week, keeping my endorphins at a good level. I was, cross training, doing some stretching. I was motivated to eat well, stay hydrated. I had an accountability partner. I had that interpersonal relationship, and everything was going well. I was, sleeping better, things like that. Now I hurt my knee. I'm limping during the day. It's waking me up at night. I don't have that accountability partner because I'm not currently running. And all of a sudden, it's been a month, and I just consider myself to not be a runner anymore. And then you kind of start to go into a little bit of that like depressive state, not depression, but just kind of down, right? Weight might start coming on a little bit, not feeling so good about that, start to isolate a little bit more. So I see this all the time where it's like that this one thing really starts to derail everything else. And then that mindset, body image, negative self-talk, belief system in self, all of that starts to get a little bit more on the negative side. And it doesn't need to, because there's people out there that can help, and it's just a matter of saying, hey, I don't accept this as my new norm. I don't want this to be my new norm. And so see if you can challenge that. See if there's something that can change. It might be, really a significant injury. It might not be. It might be something as simple as like, hey, you haven't updated your shoes in a while and it's kind of worn down, and you've been wearing a shoe and your ankle's been tilted and it put a lot of strain on the medial hamstring, and change that up, calm it down a little bit, and you're done. It could have been really something simple. Other times it's actually a real injury. So you never know. But don't let one thing derail you and get you onto this track where things start going in the wrong direction. So that's number one thing with prevention is really it does make sense to put your eggs into that basket and to find balance with a preventative mindset, because it more or less does pay off. You don't quite know what you're preventing, so you can't always prove it, but the science is there, the literature is there to say, yes, this is the right thing to do. And then if you need to react because something comes up, do. put you first, put your health first, it's worth it to get back on track so that way you just keep moving forward. So that's my 2 cents.